Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hello, everyone, and welcome to the Healthy, Wealthy, and Smart podcast. I am your host, Karen Litzy, and today's episode is brought to you by Net Health. So, Net Health and myself and the podcast, we want to talk about something important, patients and their outcomes. So, if you like to talk about outcomes, which are super important for your business, the best industry event around outcomes management is happening October 23rd to the 25th in Knoxville, Tennessee, and it's called the Clinical Outcomes Summit. It is hosted by PHOTO, which is Focus on Therapeutic Outcomes, who were also a sponsor of the Align conference, which we're talking about in today's episode. But it's not just for PHOTO clients. It's a gathering of anyone who believes in the power of outcomes management to drive change for patients, clinician practices, and payers. Healthy, Wealthy, and Smart podcast listeners get a steep discount on the registration. The full summit pass is only $150. Go to outcomesnerd.com and use the discount code Litzy. Now, on to today's episode, which was recorded live from the Align conference in Denver, Colorado a couple of weeks ago. And I welcome Dr. Kory Zimney and Dr. Jessie Podolak onto the podcast to discuss why language matters to patient care. So I went to their breakout session on language. I loved it. I've known Kory for a long time, and he's wonderful. And I just met Jessie this weekend, and this woman is awesome. She's got so much energy. She explains things in a way that you can really take it in and understand it. She does it with humor and heart, and both of them, I just thought their presentation was great, and so we decided to talk about it. So on today's episode, we talk about how language affects your actions, looking at language through the patient perspective, what is negative affective priming, and ways that you can enhance your communication style. So it was a really great talk, and I think both Kory and Jessie give a good synopsis in this podcast. So for a little bit more on Kory, he's been practicing physical therapy since 1994. Following his graduation from the University of North Dakota with his master's in physical therapy, he completed his transitional DPT from the post-professional doctorate of physical therapy program at Des Moines University. And at this time, he is in the candidacy phase in the PhD PT program at Nova Southeastern University. He is currently an assistant professor within the Department of Physical Therapy at the University of South Dakota, senior faculty with the International Spine and Pain Institute, and researcher with Therapeutic Neuroscience Research Group and USD Center for Brain Behavior Research. His primary teaching, research, and treatment focus is with pain neuroscience, therapeutic alignment, and evidence-based practice for orthopedic injuries of spine and extremities. Jessie received her master's degree in physical therapy from the College of St. Catherine, Minneapolis in 1998. She completed her transitional DPT from Regis University, Denver in 2011. She has been teaching pain science and manual therapy technique at continuing education courses since 2013. She currently owns and operates her community's first direct pay physical therapy practice, seeing a variety of patients with acute and chronic pain conditions. She has special interests in manual therapy, Pilates, spine, and running injuries. She is a certified clinical instructor through the APTA and has completed her therapeutic pain specialist certification through ISPI. So both very accomplished physical therapists, and I'm so happy to have been able to sit down and chat with them during the Align conference a few weeks ago in Denver.
Hey, everybody. Welcome back to the podcast. I'm your host, Karen Litzy, coming to you live from the Align conference in Denver, Colorado. And I am fortunate enough to be sitting here with Kory Zimney and Jessie Podolak. And we are going to talk about the workshop that they did yesterday, and we'll probably do again tomorrow, on moving our language and why language matters around people with persistent pain. So my first question is, why does it matter?
Well, words are powerful. We started off by just doing some cool quotes that words change worlds, right? And words can pierce like a sword, but the tongue of the wise brings healing. And that's just ancient wisdom, right? We've known that. Words just have so much power. They shape our perceptions. They shape our action. We know even from the research just how we look at something. So for example, one of the studies we cited was if crime is presented as a beast, okay? You can look at crime as a beast versus crime as a virus. When crime is presented that way with just those two words, and we survey people and we say, what should we do about crime? Those who hear crime as a beast, 71% say we should increase law enforcement. 51% of those who hear crime as a virus say we should increase law enforcement. So the word evokes more of an action response when we hear the beast versus virus. Another one was the economy. Is the economy stalled or is it ailing? If the economy is stalled, we jumpstart it, right? Stimulus package. If it's ailing, maybe we take measures that are really going to do long-term change. We look at education levels or socioeconomic things and what can we do with this economy. So words shape so many things in general. And in healthcare, the words surrounding pain can evoke a lot of fear. They can evoke a lot of knee-jerk reactions of what needs to get done. It can kind of force us to look at these more short-term solutions, and I think that's been a theme emerging throughout this conference, is that there's so many things that we do that are helpful in the short term, but can actually be harmful in the long term. So the words that we have surrounding pain probably lend themselves many times to short-term solutions. And if we want to look at really a sea change in how we approach pain, we've got to think and consider our language.
Awesome. Kory?
Yeah, what Jess talked about, a lot of people, I think they look at it and they go, well, that's just a little change. It was only 20% different. What's the big deal? And to me, and it's all about nudges. That a lot of times it's just these little changes that can make a huge difference for some people. And I get for a lot of people, it probably wouldn't make a big difference. But if it did make a difference for a person, why wouldn't I want to try to maximize every little opportunity that I could get? And I know some people look at it like, well, I don't think language is that big. A lot of people I can tell arthritis and they don't have a problem because I use that word. And I get that. But what about that one person that it did make a difference for? How do you know it didn't make a difference for somebody? And if we have good evidence that shows that these little changes can make a difference, why wouldn't we try to maximize every little bit of that?
Yeah, and I think that harks back to, Kory, to what you said this morning about everyone in the room has probably treated one person in pain, and that's great. You treated one person. Yeah. But you can't extrapolate what works for one person to a population. And so I agree that I think in as much as saying do no harm, changing words around that might connect with someone, I don't think is going to be incredibly harmful. Right. By reframing words that maybe we know might be a little harmful.
Absolutely.
Like arthritis, or what are some other ones from yesterday,
the hot
right?
button one for me was wear and tear.
Yeah.
How often do we say wear and tear? And what's the first thing that pops into your mind when you hear wear and tear? What's an object?
The tire.
The tire.
The tire. Right. And what's that going to do?
It's going to blow.
Right? So if I say you have wear and tear, what is kind of even a subconscious thing? They're just waiting for it to blow. And how does that influence your movement? How does that influence the adventure you have in life? How does that influence your whole being? Just knowing I have wear and tear. For some people, they might say, well, I don't care. I'm going to wear it out. I'm going to grind that thing to the ground. But for others, they might say, oh my gosh, these tires have to last me another 20 years. I better take really, really good care and back way off. So wear and tear is a hot button one for me.
Yeah. How about you, Kory?
Well, it's, the ones you hear, it's the worst knee I've ever seen,
Oh, the spine of a 90-year-old.
Right, which is all right if you're 102, I guess. But yeah, so it's just those little phrases that are so easy for us to throw around, but we have to recognize that the lens that the patient looks through is probably different than the lens that me as the therapist with all my education and training on how I look through it. And I think that's just, again, taking that patient perspective is something that we all can hopefully try to do a little better sometimes.
Yeah, and one thing from yesterday's class that I had never heard of before was negative affective priming.
Yep.
So can you explain what that is and then how we use it, maybe not even knowing we're using it as therapists.
Yeah, so then, I mean, it's really, kind of what you talk about is kind of what you start thinking about. And so if I'm telling you how you're going to lose, if you don't do your exercises, you won't be able to do these things, and just create more of a negative type of attitude to everything, in everything the patient sees then will be directed more towards the negative. Where if you can flip it to more of a positive type outlook, as far as when you do this, you'll be able to do these things and you can do that. And again, always flipping it to more of a positive direction. So again, you're just priming them, nudging them, turning them towards things that they can do, as compared to, you lost this, you won't be able to do that. So it's those little shifts and changes. To focus on those positives. I know as a clinician, you struggle like, God, our patient's so negative, and then we come up with these negative phrases sometimes, and it's like, well, how are we helping prime them the right direction?
Right, and what are some examples of maybe common negative priming that we may do as therapists?
Yeah, so that's, those things that, if you don't do your exercises, that shoulder's going to only get worse. If you you're overweight, this puts lots of extra pressure on your knees, they're more likely to wear out. And so again, it's just those little negative type of things that's so easy we can look at. We're talking about what they lose, the kind of the gain aspect or the loss aspect, and oftentimes we tend to talk about the losses. And patients will get focused on that, on the negatives. That's just human nature that we focus on negatives. And as a clinician, if we're adding to that, it's only going to multiply more so. But I think back in younger days as a clinician, I'd always get so proud of if I could get their problem list to 10, I thought, how cool am I? I'm double digits, just get that problem list as long as possible, but really looking at, the optimism list. What things can they do? Mm-hmm. What things can they do better? And, isn't that, how cool is that you can do that? And in focusing on those things, on what they can do better, what things they can do, instead of on what things they've lost, what things they couldn't. So that's that kind of priming, kind of nudging more into a positive direction compared to our traditional, you got a dysfunction, you can't do this, you're broken.
Yeah.
And even the way we asked that question, Lindsay had just a really nice thing this morning that she talked about with goals. Instead of, I always think of, what are your goals? And that's kind of an obscure thing. But I think she asked it in a way that was something like, tell me something that you'd like to do more of, be better at, or return to doing that you currently can't.
Yeah, that's a much better question.
Right? It's just, it flipped it, because it started, there's this great quote from a TED Talk that I love by Kelly McGonigal called Making Stress Your Friend. It's awesome. But she has this quote in there near the end where she said, it's so easier to run towards something than away from something. And if you look at your patients, what do they write in their goals? I want to get rid of this pain. Mm-hmm. I want this away from me. I want to avoid it. It's so overtaken their life that it's this, they're running from it. But if we can just direct people towards what is to come and kind of set their even get them to maybe cast a little vision, which I know is scary, right? And you don't want to have false hope. We talked a lot about that, about how to balance reality and honesty, and sometimes to say, I'm not sure how this is going to turn out, but I'm with you in it, right? And so, but I think, this is the worst I've ever seen, or, man, this is the biggest trigger point I've ever felt. No wonder you hurt. Those things come from a place of pity or sympathy, or which it's well intended, but it's not as far on the empathy and compassion scale that we want. We want that empathy and compassion of, I see where you're at and where you've been, but I'm with you as we go forward, I guess, is how I look at it.
Absolutely.
And on that note, we're going to take a quick break to hear from our sponsor, Net Health.
Let's talk about something important. Patients and their outcomes. If you love to nerd out on this kind of talk like I do, the best industry event around outcomes management is happening from October 23rd to the 25th, and it's the Clinical Outcomes Summit. It's hosted by Photo, but it's not just for Photo clients. It's a gathering of everyone who believes in the power of outcomes management to drive change for patients, clinicians, practices, and payers. And the best part, Healthy, Wealthy, and Smart podcast listeners get a steep discount on the registration. The full summit pass is only $150. At that rate, go ahead and bring your entire team. Go to www.outcomesnerd.com and use the discount code Litzy. That's Litzy. Hope to see you there. Yeah, and I think that sentiment of, yes, I'm with you, but being honest. So it doesn't mean everything's pie in the sky.
Yes.
And I think that's where people when they hear about this explain pain, quote unquote, or PNE, they think, oh, you're just talking away the pain and you're not being honest, you're not being realistic. But that's not what we're saying when you're talking about language and talking about communicating with someone who has persistent pain. So one of the examples we used yesterday was like Hip-O-A. We said, yes, you may have pain and we're going to work on strengthening. There is a chance you might need surgery, but if you do, you'll be stronger going in.
Yes.
So you have to be honest. You can't say to someone with severe Hip-O-A, you'll be fine, just do a couple exercises. It's just not realistic. And then when the person isn't fine, that's a steep fall.
Yes. Yeah. And it goes back to this not swinging too far on the pendulum away from the bio. It's still biopsychosocial. And how do you explain something that there are biomechanical or issues in a way that's not scary, that still honors the bio, but that kind of decatastrophizes or softens? It's really just about softening and responding, like watching the patient's nonverbals. You can tell when you're starting to freak somebody out.
Oh, yeah.
Right? And so then you make the adjustment and you just be very, very present. So it's certainly our language, but like as, Kory talked about, is communication. And I really like what Jonice said about pain neuroscience communication.
Yes, versus
not just
education.
So education, I, the smart therapist, am going to teach you, silly patient, about how this works. No, this is about communication and dialogue, and how do we do that?
Yeah, and Kory, something, I think you said this yesterday, but correct me if I'm wrong.
If it's good, I'll take credit
for
it.
Okay.
All right. I think you said that the body is not fixed, rather a robust ecosystem that has the ability to change and grow.
Yeah. And that was actually a TPS grad that we had that talked about that.
Oh,
they
okay.
used that in their metaphor.
Yeah.
That's that idea that, again, and that's just it. I mean, the beauty, the amazing plasticity. And I go back to when I used to, work someone in a rehab unit, and when a patient came in with a stroke, you knew there was brain damage. You could see the MRI report. But the beauty of it is you had no idea what they might be able to function and do afterwards, right? Because you'd look at those areas that were destroyed, where the infarct was and stuff like that, and some of them amazingly regained function and the ability to walk and their ability to transfer and get out of bed. So you just always had this ultimate optimism, as the traditional neuro type of rehab therapist, when somebody had come in with their stroke or spinal cord and their ability to be able to do things. But for some reason in the orthopedic world, we just have this like, oh, well.
Sorry.
Yeah.
Sucks to be you.
You know what I mean?
You're to hurt. This might hurt a little.
Yeah.
Or a lot.
And it's like we just create this, like the body can't be adaptable to these things. And now, like I said, now that they've done the imaging studies on normal people, we're all walking around this stuff. We've all had this beautiful adaptability, whether it was from a neurological, orthopedic, any kind of change that's gone on our body. But we don't ever appreciate and look at that from that optimistic, again, in realistic sense, But again, we know that if you have a little tear in your meniscus, that might be an issue. Yes, if it's a huge bucket handle and you can't straighten your knee out and it clicks every step, yeah, that's probably a major deal. But otherwise, a lot of people can get by with that. Now, I don't know with absolute certainty, but the beauty is we should be able to find out in 4 to 6 weeks, because we can train the body, help it become more adaptable. We can explore different motions and movements and see how you do with it. And if it still doesn't, the awesome thing is we do have surgical options to make that better. And so that's just that beauty of appreciating the adaptability of the human body. And I don't know that for some reason, we seem to have lost that appreciation to some degree.
Yeah, and I think that's something that I know I'll be using with my patients, just to say, listen, you are this robust ecosystem. And I think if we share that with all of our patients, I think they may have a mind shift change there.
Yeah. If you think of ecosystem, so many things go into it, right? It's not just the musculoskeletal. I think just that if people could really view the body as juicier and more robust and just the multifactorial, and I think that's where maybe we got off track, is we just started seeing the body as a machine.
Yeah,
right?
As a car or a machine, which I have to say is my pet peeve. I hate when people say, your body's just like a car. I'm like, no, it's not.
Because your car doesn't breathe, it doesn't have feelings
not
and
even,
emotions.
We're not mechanics, we're not this. Like, that is not how it works.
It doesn't get jealous of the Mercedes.
Yeah,
Up,
exactly.
right?
I'd like to think as people we're a little more complex and in a very good way, right?
Yes.
So now, what would be your the thing that you want people to take away from why language is important when it comes to working with people with persistent pain?
For me, it's just being mindful of that. Taking that moment, and again, not to, again, as a therapist, don't overthink it either. Don't think, oh, what words can I say? And if I said arthritis, oh crap, the patient's going to catastrophize and never be able to walk again. No, but just be mindful of it and be present with your patient, because when you're truly present with your patient, you can see that look in their eye. And you can get that sense that they're maybe getting a little bit worried or catastrophizing or a little anxious and stuff like that. So it's that ability to just be present, mindful that words do matter, but again, not so overly mindful that you freeze and you don't act either. We still have to just be human, but again, just being a part of that, and again, that's just that communication piece that really is what we're talking about.
Jessie?
I would just echo what Kory said. It's just be with your patients, care, invest in them. They're, especially some of the patients who it takes every ounce of energy they have just to make it to your appointment, realize that they're giving you the trust and the kind of the gift of their time and their precious energy. And so even when you have that busy day, even when you're kind of sucked dry, just to give them that time that you have with them and to slow down a little bit, listen, be mindful, and I just think it's just about being a little softer, just softening out the rough edges and being that safe place. Louis Gifford, one of our heroes, said reassurance is analgesic, and sometimes we can't reassure that hip is going to not need surgery, but we can reassure that I'll be with you. We're in this. I'm in this with you. So that's what I would say.
Awesome. Well, thank you so much, Kory, Jessie. I appreciate both of you, and I really enjoyed your talk yesterday. So thanks so much for coming on.
Thanks
for having us.
A huge thanks to Jessie and Kory for a great synopsis of their talk. Aren't they great? Don't you wish you were there? I learned so much from them. So thank you very, very much. And of course, thank you to Net Health for sponsoring today's podcast. So again, Net Health and Focus on Therapeutic Outcomes, are hosting the best industry event around outcomes management from October 23rd to the 25th in Knoxville, Tennessee. It's called the Clinical Outcomes Summit. Healthy, Wealthy, and Smart podcast listeners get a steep discount on the registration. The full summit pass is only $150. You will not find a better deal in any conference this year. At that rate, you can bring your entire team. Go to www.outcomesnerd.com and use the discount code Litzy.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.